How do you guys help providers with the financial risk component? Obviously, there's that initial dip because we're shifting away from volume to value. So, there's going to be a change in revenue during that initial period of time. But I'm also curious about financial risk in the sense of developing an appetite for downside risk, after they get through that initial financial investment just to get into value-based care, how to grow in value-based care from a financial standpoint.
Yeah, I certainly, if a provider jumped straight from fee for service to global risk or downside risk, there would be significant financial risk. But, I mentioned earlier, we don't really want to put our providers in value-based contracts that they're not operationally or financially ready for. So, it doesn't make a whole lot of sense for either of us to be in that situation. So we want to make sure that our provider partners are going to be financially viable and in sustainable practices because they truly are the ones we rely on to provide care to our members. And so going back to that concept of the value-based care continuum, the first stage away from fee for service is about just providing additional financial rewards and bonuses, but it's built on a fee for service chassis. You
Yeah.
still have a fee for service chassis or model, and you're building kind of these additional bonuses and models to help you move to that next stage, to provide some of that additional capital that might be necessary. And so as we move along that continuum toward upside risk only, then we start to move the operating and clinical model toward a true value-based care chassis, but at the same time still mitigating that financial risk because practice is still only getting a reward for taking good care of patients and not being penalized for taking that financial or medical risk when they might not be ready for that just yet. And so, we want practices to make this transition at their own speed as they're ready, as they're able to, and we want to be there to help them get to the place they want to be. Whether it's through those contracts, whether it's through the support with IT platforms or data and analytics, because we do know it is a major shift in a business model that's existed for hundreds of years. It's not going to be easy to change overnight. And so only when practices truly are fully transitioned
Mhm.
and ready to bear more risk do we then contract full global value-based care contracts. And even then, we will work closely together to ensure that the partnership works together to continue to mitigate those risks and also to set them up for success. And, that having been said, I think that is why it's so important that you understand how that payer you're going to work with is going to work with you during this transition, that you truly have a partner that is working with you rather than just, throwing a contract at you without understanding if you can really manage that risk. And so, I also don't want to, diminish the notion that a large amount of capital investment is needed to successfully transform from a fee-for-service organization to a full value-based care organization. There's investment in people and processes and IT infrastructure, among other things, and it's got to be something that is done with some clarity. And there, I would say, rather than the financial risk associated with taking on those contracts, I think there's more risk associated with implementation risk during
Mhm.
this time of transition. And so there are companies like Alidade, who we've
Yep.
partnered with to help practices without those extensive capital resources to help them make that switch to value-based care with the needed tools, the technologies, the know-how, and to be able to lean on specialists like that can, I would say, really help to mitigate both the financial and operational risks during that transition.
I mean, you can't have big change without some kind of risk, right? Some kind of at least the threat of something. There's going to be a little hard work to get it over there.